For stroke patients, data proves that time is brain. The earlier a patient can receive drug treatment, particularly the tissue plasminogen activator, TPA, the better. Recognizing this fact, in 2013, Doylestown Hospital endeavored to reduce its door-to-drug delivery time for patients arriving by ambulance. The organization set process goals: hospital door to CT scan, 25 minutes; door to CT read, 45 minutes; door to TPA, 60 minutes. To begin, Doylestown reviewed standard stroke identification and care. Symptoms were usually recognized in the ER by the attending physician, who would then call a stroke alert into the hospital team. To help ensure team mobilization for stroke treatment and faster drug delivery, Doylestown collaborated with the EMS on a pilot study. Stroke alerts would actually be called into Doylestown from the EMS field. During the initiative, Doylestown implemented a stroke blast, a communication with the medical and EMS team after each stroke alert. The blast informed the team about patient outcomes and helped identify any possible areas of improvement. Doylestown's program yielded significant results. By 2014, door to CT performance was at 93.9% of their goal, and by 2015, 100%. In 2014 and 2015, the door to CT read was at 100%. In 2014, door to TPA was 57.1%, and in 2015, the key measure was at 80.9%. Doylestown further upped their mission by decreasing their door to TPA delivery target to 45 minutes. By 2015, their data showed they were at 71.4% of meeting their goal. For their work to better patient outcomes, we are proud to recognize Doylestown Hospital as the third-place recipient of the 2015 Delaware Valley Patient Safety and Quality Award. Aspiration pneumonia, or AP, is a serious, sometimes lethal condition for hospital patients. In 2014, the Hospital of the University of Pennsylvania set out to decrease the risk of aspiration and the potential of AP. First, the team. Consisting of nurses, physicians, and speech and language pathologists, the group brainstormed on areas of improvement and possible interventions. They developed and began to implement Project Sit-Up, short for Screen, Identity, Test, Understand, and Plan. A nurse-driven screening tool was created, which consisted of 3 steps. Step 1. Using standard risk criteria, nurses screen all patients at admission. Step 2. If any risk factors are observed, the nurses work with physicians to establish a nothing by mouth status. Speech and language pathologists are also consulted for evaluation and care planning. Step 3. For patients with no evident risks, nurses conduct a 3-ounce water drinking test to check for any possible difficulty swallowing. To ensure that all screening data and results were immediately available, the hospital created a documentation form. The form was seamlessly integrated into the inpatient electronic medical record, allowing for enhanced communication and best patient plans. The project team also worked with the nursing professional development specialists on an online learning tool to promote continual education and training about aspiration prevention. 12 months after the start of Project Sit-Up, cases of AP were reduced by an incredible 40%. For their efforts to enhance evaluation and team collaboration for better patient care, we are thrilled to acknowledge the Hospital of the University of Pennsylvania as the second-place recipient of the 2015 Delaware Valley Patient Safety and Quality Award. McGee Rehabilitation Hospital serves patients with some of the most severe spinal cord injuries in the country. It's a challenge the organization meets with resolve, ranking in the 100th percentile for acuity. In 2012, McGee began its journey to prevent pressure ulcers, dangerous developments in high-risk patients. Through its new database and meticulous comparison, the McGee Leadership Group made an important discovery. Several patients with unexplained skin breakdowns had recently started antibiotics, which led to intestinal issues, superimposed on existing bowel incontinence. McGee also recognized that their patients had undergone intense, life-saving treatments. As a result, many were entering McGee's doors malnourished, increasing their risk for skin ulcers. To address these concerns, McGee formed an interdisciplinary team. They ran daily reports and met to discuss each patient whose skin was threatened by bowel incontinence. They collaborated on solutions to regulate systems and protect skin. This daily meeting was one of McGee's many collective approaches. New equipment and added staff were secured for the endeavor. Bracelets were designed to alert other facilities about the need to turn patients while they awaited care. And when increased protein intake was made a high priority, McGee dietitians secured an innovative liquid modular protein that is easily digestible. Prevention strategies were shared with every hospital discipline, along with patients and their families. McGee even created its own video to further engage and educate.
Come on, my friend, won't you change your ways? Something you need to see. Doing the butt, lift and shift that.
The results? In the fiscal year 2015, McGee reported a remarkable 45% reduction in serious hospital-acquired pressure ulcers. For its dedication to protecting at-risk patients and its unique approaches to fostering a committee culture, we are honored to recognize McGee Rehabilitation Hospital as the first-place recipient of the 2015 Delaware Valley Patient Safety and Quality Award.